Hey everyone, it's Alex with the PCRI, and today I'm talking to John Shearron. He's a member of our PCRI team, and he works on the helpline. So the helpline, if you've watched any of our videos, you may have heard of it. It's where you can submit your information and personal case information to them, and they can help give you information about treatments, side effects, lifestyle, and that way you could have better outcomes talking to your medical team. It's information, not advice, but John is full of incredible information on almost any subject I talk to him about, and today we're going to be talking about something very specific, in penile injections. And so that can kind of get awkward as a conversation for a lot of men, even between them and their doctor. So we're going to get into the details of what it is, how it's used, and the effects of it, and when it's applicable. For people who may have not watched our previous videos and they may not be familiar with your case, can you give me like a 2-minute synopsis of some of the treatments, what stage you were when you were treated? And I know it's hard to get that into 2 minutes, but if you want the longer form version, they could watch the video.
When I was first diagnosed, I was 45. I'd never had a PSA before. I had gotten a test that I purchased online that had a PSA in it. I went to a blood draw center. My PSA came back as 12. I didn't know that that was important. I got a call and they said, Mr. Shearron, your PSA is really high. You need to see your doctor. My question was, what's a PSA? And I go to see my doctor, said, this must be a mistake. They tested me again 3 weeks later. It was 15. And then I had a biopsy, like a painful biopsy, unfortunately, like a lot of men go through. And they said I was Gleason 6. And I'd only been researching this for 2 weeks when I got my biopsy. And I said, that doesn't make any sense to me. So I had 2 separate opinions from 2 outside experts. And they both said my original pathologist was off. He was actually way off. And I was a 4+3. So I went from 3+3 to 3+4 to 4+3, going up the scale. And at that point, I decided to seek out some extra help. And I found a doctor that I really trusted. I worked with him for a long time. And over that period of time, I ended up getting a cryosurgery is what I ended up getting. But I don't suggest that for most patients. It failed quite often. I was very fortunate in that all my cancer was on one side of my prostate, so I had focal cryosurgery. And that worked. My actual diagnosis was in 2001. It's now 2023, and I'm healthy and alive. We didn't have the PSMA PET scan back then, so we really couldn't get a sense of what was going on. And we also didn't have the 3T MRI, so we could do targeted biopsies either. So I had a very intelligent doctor, and he said, you know what, let's do a saturation biopsy where basically they took 40 cores to make sure that I didn't have cancer on one side of the prostate, and that was all on the other side. And when they did that, my Gleason was upped again to Gleason 8. So that's why it's so critical to have a proper fusion biopsy using a 3T MRI, making sure that we don't miss anything. And a second opinion. Nothing's more important than that second opinion as well.
Yeah, absolutely. I mean, the second opinion on pathology and confirming your Gleason grade, that's critical. Every time you tell me the story, I kind of like wince a little bit at the idea that you had 40 cores instead of like the typical 14. Can you also tell us, was that painful, and were there any side effects from this?
That's interesting. I got along great with the doctor that I had, and I said, look, I don't like anesthesia, and I know you're going to put me out for doing 40 cores, so I want a spinal. And so they give me a spinal, which basically numbs you from the waist.
Do you do anything normal?
No, in fact, it's funny is when the doctor came into the operating room, he looked at me, then he looked at the team, and he said, why is he awake? And he goes, oh, now I remember, they agreed to give me a spinal. And they said, do you want music? Do you want headphones? I said, nope, I want to hear everything. And the funny thing is the doctor said, just between you and me, if I was going to do this, I would do exactly what you did.
Your prostate cancer story is quite unique because you made very unique decisions. And I think that one of the greatest things that I've seen over time with patients is when they research their own prostate cancer, they decide to, embark upon this process as the advocate of their own health. And then they're able to make customized decisions for them, which you definitely did. And then, the outcomes of that very patient to patient, but let's talk about the outcomes of the cryotherapy that you had. So, what type of side effects did you have, and then kind of where are you at right now?
Well, I was so young at the time. I was 45. The doctor is very concerned about me living. And normally in cryosurgery that he would do, he would freeze and thaw the prostate twice. He kept me in the operating room longer. He actually did it 3 times. And he said, you're going to need a catheter and you're going to need to keep that in for 10 days. He outfitted me with the catheter. And the next morning I went to Disney World and I got to go to the front of every line because I had a little electric scooter because I couldn't really walk very well with a catheter and the bag strapped to my leg. And then I flew back to Chicago. I didn't have any problem. After 10 days, I took out the catheter myself. It was no big deal. It didn't bother me. I went to work every day. No one even knew I had it. I didn't really have any side effects to speak of. I was very happy with the outcome.
Obviously, it had a great effect, but later on you did go on hormone therapy. So, what was the in between of that?
Hormone therapy. I was on hormone therapy prior to the cryosurgery. And okay. I was on that for 18 months. And I had every side effect known to mankind. So I had hot flashes in the middle of the day. I'd feel like it's 110 in my office or in a meeting. You'd start sweating. Usually that lasts 10 minutes, go away. I had severe hot flashes at night. I'd wake up, 2, 3 a.m. and the bed would be soaked. It was like I just ran a marathon in bed while I'm sleeping. I had some brain fog near the end because I was on it for 18 months. I'd say the last 6 months is when brain fog started. It got a lot more serious near the end. In fact, at that time, I was learning how to fly gliders, and I was one lesson away from getting my license. And I didn't feel safe to fly because the brain fog was there and I wouldn't go up. I had muscle weakness, although not as much because I continued to exercise throughout my hormone therapy. And so my muscle weakness was minor, extremely minor. I was much more emotional. Things I wouldn't cry at, I would cry at. If you're watching a movie and you're a guy, someone's crying on the screen, yeah, big deal. On hormone therapy, you're crying with them. One of the things that I grew up doing was running long distance. And part of running long distance is it's not fun. And if you're doing it in competition, you're on the edge of pain and wanting to quit all the time if you do it right. So hormone therapy for me was like that. I go, yeah, okay, I'm sweating, I'm getting hot. The bed's going to get soaked at night. I'm going to forget a few things. I'm going to be more emotional. So what? I'm alive. I'm happy to be alive, and I'm happy to have the therapy that's keeping me alive.
So when you say that the hormone therapy rewired your brain, would you say that the results of that rewiring are still here and lasted past the treatment?
Absolutely. There's not that much difference between males and females. There really isn't, especially biochemically. So once you've taken a testosterone away from the male, the brain thinks you're female. And I'm a thin guy. I've weighed the same since I was in high school, within like literally 2-3 pounds my whole life. I went from 144 to 172 on hormone therapy, and I really didn't eat any more than I did before. My skin had a thicker layer of fat underneath it. My face was not as angular, much rounder. And there's a big difference in my appearance. In fact, there was such a big difference that at the end of hormone therapy, I found a new doctor just for a GP. And at that time, I was at 172, a very full, round face. And when I saw him again a year later, I was back down to 144. I looked the way I do now. And when I walked in the room, he looked at me and he said, wow, you don't even look like the same person. The emotional part of rewiring the brain is definitely there. Definitely there. And I don't mind it. I think it's great. I think I look at things with a much more compassionate viewpoint.
That's pretty awesome. I've heard this from other hormone therapy patients too, where they've appreciated the perspective, especially if they have a female partner and they feel like they're just able to understand them and emotionally connect with them. So there's a silver lining to that.
I agree. I was very much a type A person to the extreme when I was very young. And in fact, one day when I was 25 years old, I remember going home after work and thinking, I'm not a very nice person. I'm really hard on the people that I work with. And I decided that night, that I would change. And I changed. I never went back. I was unnecessarily tough on people. And so that would be one thing that really changed my life. And the hormone therapy was like step 2 to that. So I'm actually grateful. I am grateful for the hormone therapy in many ways. That was one of them. And obviously, the fact that I'm still here is the other.
So, one of the things that you and I have talked about previously, just in personal conversation, is your experiences with penile injections. Now, obviously, for a lot of men, this is a sensitive topic, and I really appreciate you coming on this channel and talking about it because it's a thing that a lot of men have to deal with, but they don't have a avenue. I find a lot of resources are not out there with somebody who's experienced it and somebody who can give them clear-cut advice on the how you take it, what you do, what happens if you take too much, what do you do when you take too little? And these are often questions that it may be easier for a patient to watch this video than even talk to somebody in a doctor's office or talk to definitely a friend, because still in today's society, especially in American culture, I think it's just across the world, but I would assume more in American culture at this time, that, talking about the concept that you have erectile dysfunction and you need something like a penile injection in order to help with that still has a very negative viewpoint, when I think I'm really grateful that these things exist and that so many men are being helped by them. And I know that you and I together, we were here in September in 2023, we're watching John Mulhall's talk, and he's talking about the benefits of penile injections and kind of the situations around them and how effective they are. Now, knowing you, because you tend to do things a little differently, which I do appreciate, did you actually need it, or were you doing it as an experiment?
Viagra works for me. And I know that there are men that it doesn't work for them. So they have really no choice, if they want to try something, to move to Trimix, penile injections. But I wanted to see, because I'm talking to a lot of the patients, and I need to know, what's it like to use? How does it work? What happens when you use too much, which I actually did on purpose? What happens if you use very little? And just to kind of get an idea, because I can't really talk to someone unless I've tried what it is that I'm telling them to do. So I didn't technically need it, but I need something. So I decided to give it a try.
No, that makes sense. So can you tell me the story of Trimix? And this is really, the example of the story is to show in real life how patients are not getting the education that they need, even in a doctor's office. Can you share the story of when you went to go get it from the pharmacy?
So Trimix you usually pick up from a compounding pharmacy. It's not something you usually get from CVS. And so I go to the compounding pharmacy to pick up my Trimix, and I'm in line behind another gentleman who's African-American, who's standing at the counter, and he's paying for his Trimix. And the person behind the counter says, "Have you used it before? Do you need help?" And he said, "Well, I don't think I need much help. I just need to know, where in my leg do I put the needle?" And I'm thinking, oh my God, the doctor prescribed Trimix to this gentleman and didn't even tell him that this is an injection into the penis. I was totally just dumbfounded that any medical professional would do that. They proceeded to give him an education on what he needed to do, and then he left. But I was actually in shock that somebody would tell someone to go to the pharmacy and pick this up and not tell them how it's going to be used.
Yeah, unfortunately, I find this pretty widespread in multiple disease states, that oftentimes I think doctors are like, "Here, take this," and there really isn't a lot of conversation about how it works and what to do. I think a very helpful hint, and this is definitely, your story proves it. I was interviewing Jan Mannerwright from Cancer ABCs, and she was saying, make sure your pharmacist is part of your medical team, because it's really important that you understand how to take these drugs and what to do. Don't just rely on the doctor and the nurse. Ask the pharmacist, because they're educated in these areas. And to your point, I mean, it is really sad that we see so much, under-education in these circumstances, especially about something so personal. You're about to inject something into your body, and not just that, your private parts. That's really intense. So I'm glad that he was able to get the help he needed. Now, you knew what Trimix was and knew what to do. How did you know?
Well, I talked to my doctor about it, and he told me that he would start with a very low dose, gave me instructions on where to inject and how to inject, and I followed them. Now, I have to say, I don't think there's any guy out there that would say, this is a lot of fun. You think about putting a needle into your penis. I don't think anybody really wants to do that. Does it hurt a lot? No, it doesn't. But it does hurt. And I think if you tell a man up front, if you're honest with him, I mean, totally honest, I'd say that 99% of the guys, they're fine with that. What 99% of the men don't like is when you don't tell them up front what's going to happen. So yes, it hurts. Okay. It's going to hurt. It's going to hurt for a little bit. It's not going to kill you, and it's not going to be an excruciating pain, but it hurts a little bit. I got great instructions from my doctor, though.
Hmm. So let's get specific. Where in the penis are you injecting this?
When you are looking down at the penis, and if you think of the top part that you can see is 12 o'clock, you're basically looking for around 2 o'clock or so. You're trying to get between 12 and 3 on the dial, basically. And you're also looking for any veins that are there. You're going to avoid those.
When you're doing this, is it, you're talking about the pain from injection. Is it the injection site? Is it the entire penis that's hurting? What specifically?
It's the injection site specifically, right when you're injecting it. The needle is specifically sized for this. So this is not a really long needle. The doctor will prescribe the right length, and that makes sure you're not going too far. If you don't follow the instructions, you can get a black and blue penis. It's not medically a big deal. Optically, looking at it, it's a big deal. It looks like you're hit by a truck, because it's all bruised, but it goes away. It goes away within a few days, and it doesn't really affect you. But I just want everyone out there to know that this is one of the things that can happen.
So when you say black and blue, is that painful in itself?
No, not at all. In fact, there's really no pain to it. It's a bruise without pain. The only pain that you're going to have is at the injection site, and it's just temporary.
So based off of what your doctor told you in that needle, how deep were you going?
So the length of the needle, I believe, is approximately 1/2 inch, somewhere in that neighborhood. And please, nobody take me up on looking it up exactly, but it's not a really long needle.
And did your doctor tell you to insert the entire 1/2 inch into your penis?
Yes, usually you insert it all the way up to where the plastic on the needle is, as far as you can go.
Let's talk about the packaging. Did you have to put the syringe together? Did it come already packaged? What process was there in that? Did you need to drink water? Was there a certain time frame you needed to do things?
Hydration isn't a part of this. The needle itself is pre-packaged. You don't need to assemble it. It's a very small gauge. It's a gauge that someone who has diabetes might use, somewhere in that area. It's not a very large diameter needle. It's very thin, which also means you're not going to get a lot of pain out of that. As far as the packaging goes, what you're going to do is you're going to take the needle out of the packaging. You're going to take the top off the end of the needle on both sides, the sharp end and the part where the plunger is. You're then going to take the small vial and you're going to turn it upside down. You're going to take the air out of the needle and you're going to pull back on the plunger to take the solution down into the needle and then pull it out of the device, or you want to call it the bottle.
You're filling in the needle yourself from a bottle.
Exactly. If you've ever watched a doctor or a nurse give you an injection from something that came from a bottle, you're doing the same thing to yourself. Okay. If you see any air bubbles, you're going to click it with your finger. You're going to try to get the air bubbles out. Push the plunger up just a teeny bit to make sure a little bit comes out the tip, a little bit of the solution, so there's no air in there. And you're going to go from there. When you get the needles, along in the packages will be some sterile wipes. So you're going to wipe the penis so that it's sterile with an alcohol pad first.
So one of the things that I think I've talked to a couple helpline patients about, they were kind of concerned, would they see blood when they injected themselves? Did you see any based on your experience?
Well, it depends on how you do it. So after you inject, you withdraw the needle and usually put your thumb over the injection site and you keep it there for a couple minutes. And that will stop any bleeding. If you don't, that's a mistake. You'll get some bleeding. So Right after that injection, you're going to put your thumb over the injection site and hold it. And you can also massage it a little bit because that'll let the fluid go into the chambers of the penis. But that's about it. And you shouldn't get any bleeding unless you unless you didn't put your thumb over the site.
So typically how many needles were you given? And then how many, I would say, doses did you get from the bottle?
The needles are 10, and the dosage is going to be very different from patient to patient. They can compound this formula in many different ways. So if you're lucky, they will give you a formula that's not very concentrated, and you'll hear why that's lucky later. Maybe you'll get 10 doses out of that. Maybe you get 5. It just depends on the concentration that they decided to use. If you do this through your doctor and through a compounding pharmacy, it's not all that expensive. Men who decide to bypass their doctor and go to these places these clinics that they hear of on the radio, they're going to pay through the nose for it.
Can you explain to the audience, we've talked about compounding pharmacies before, but maybe there's a patient who's not familiar with them and has never done this before. Can you explain the difference between a compounding pharmacy and a regular pharmacy?
So a regular pharmacy takes drugs produced by the drug company and bottled by the drug company. The pharmacy itself, the only thing they do is they touch the bottles, open the bottles, and count out the drugs. And that's all the pharmacy does. A compounding pharmacy, a good one, will usually have a clean room. When you walk into this pharmacy, you might see the clean room where they actually take various different compounds, put them together, and put them into capsules or into bottles if it's a liquid for the patient. They're taking the place of the drug company in this clean room locally.
So what was the time frame between injection to actually being hard and ready for sexual activity?
That also depends on the dose. So if you have a really good doctor, what he's going to tell you is your goal in the beginning is to fail, and is to be ready to laugh and be ready to not have an erection, and to tell your partner this up front. This is an experiment. There isn't any doctor that can tell you exactly what your dose is going to be. It's just not possible. So in the beginning, don't be disappointed if it doesn't, quote, work, because you're going to do it again and you're going to up the dose the next time to see if you're going to be able to get an erection. And as far as getting hard it could take you anywhere between 5 minutes and 15 to 20 minutes. It's a progressive thing. It's not an instant thing. It's like blowing up a balloon slowly, not quickly.
I think it's interesting because I don't oftentimes think that patients think, what is the proper dose for me? A lot of times we're giving these set doses and prescription medicines, and this is going to work across the board for everybody. And that's just not true. And so I think having that conversation with your doctor regarding dosing is extremely important. One of the questions that I've gotten from Helpline, and in the comment section we've seen this too, is when is the next time I can try? So let's say on the first time it didn't work. Can I try 12 hours later, 4 hours later, the next day? How long should I wait?
I would actually wait until the next day. That's what I would do. I wouldn't try it again in 12 hours or within the same day. And if you wait a few days, there's no harm in that either. And if you have to wait a week, there's no harm in that either. But you don't have to wait that long. But I would probably wait a day to try it again. Also, each time you inject, alternate the sides of the penis that you're doing it on. So the first time if you're looking at the clock, you're going to do it between 12 and 3. The next time you're going to be doing it between 12 and 9. And you alternate sides.
So when we're talking about the sides, though, we're talking about the base, not the tip, correct?
Correct. The base of the penis where it meets your body.
Yeah, I think it's really interesting because there's so much that is kind of intricate about the situation. I think that patients are very excited sometimes about the treatment because maybe they've been on Viagra or Cialis and it's not being effective for them, which is actually the definition of ED, especially in prostate cancer, is if you're failing you have erectile dysfunction and you're failing getting an erection or getting hard on Viagra or Cialis, that is the definition. I think a lot of times patients think about erectile dysfunction and they think, if I need to take the pill. But in reality, after prostate cancer treatment specifically, even, it's after those treatments. So were you taking Viagra and Cialis along with the injection?
I was at the time, very low dose though. I was basically taking 25 milligrams, which would be 1/4 of the highest dose of 100 milligrams.
Okay. So how long did it take you to find the right dosage for you?
It probably took about 3 or 4 times. I decided that because I'm on helpline and I talk to guys all the time. I wanted to try too much. So I knowingly put too much in. I injected myself. I have to tell you, this is why you try to fail, because it's really painful. You'll have an erection for an hour or 2 hours that won't go away. And obviously they say if you have an erection longer than 4 hours, you need to go to the hospital. Even if you have an erection for an hour that won't go away, you're thinking, oh, this is great, right? It isn't when it's painful, and it's very painful. And the reason why I tell patients to please try to fail, hope that you fail, is because we don't want to overshoot the goal and have a patient that on his first time out is in pain, because most of those patients will never try again. Even though they could do something very simple, like cut the dosage in half, they just won't even try again because it's actually quite painful.
No, Dr. Mulhall mentioned that a large percentage of men on their first time unfortunately injected too much and they experienced that pain and were saying, I'm not doing this. This is absolutely ridiculous. So when you did that, which I just think it's incredible that you do what you do, because it gives you some great context for how much is too little and how much is too much. How long did it take for the pain to go away? And did you do anything to mitigate the pain? Did you take, some Advil or anything?
There is a way to mitigate that pain if you inject too much. I think it's norepinephrine. It's something where you actually have to ask for it. It used to be used for colds and flu. Or like stuffed up sinuses. Pharmacies have now taken it, putting it behind the counter because it's extra strong. And so what you do is if you inject too much and you're in pain, you take a couple of those pills, and that actually will reduce the erection. And so that will reduce the pain.
Is it like an antihistamine?
Yes.
With getting hard and getting an erection, and men who have different types of prostate issues, obviously this is going to vary patient to patient. A lot of times they're wondering if, since they took an injection and they're going to last longer, how the orgasm will be if they get an orgasm. So first of all, can they get an orgasm? Obviously that varies patient to patient, and what that would be like.
Okay, so that will vary by patient to patient. By the way, along with prostate cancer and any cancer, by the way, can come depression. So men that are on anxiety medications, depression medications, many times can't orgasm. So I just want to put that up front. And this isn't going to change that, the ability. So it doesn't really change your ability to orgasm much. The difference is that when you orgasm, you're still hard for a while. And sometimes it can be quite a while, but not painful. And really, it's on the positive side, it's great. It's like you're 19 again.
Define not a while. Like, define a while that you could be hard after orgasm.
Sure. For many men, some men will actually be hard for 5 or 10 minutes after an orgasm. A lot of men, they'll immediately not be hard afterwards within a minute or two. But on Trimix, maybe you'll be hard for another 20 minutes.
When we talk about erectile dysfunction, there are two different topics that I've talked about with Dr. Schultz quite extensively in other videos. One is libido versus potency. So I think a lot of times that men who are injecting themselves, maybe they don't have a lot of interest in sex and they think, oh, this may change that. And it could. I mean, it definitely could. But there's a huge difference between the interest in sex and the ability to get an erection. And penile injections are definitely working with the ability to get an erection. For your particular situation, were you on hormone therapy when you did this experiment?
No, I was not on hormone therapy at the time.
Yeah. So, I mean, there's so many factors that affect potency, and the concept that, you can get erection, but the concept of how you feel, depression, as you've said, what's the environment, all of that is definitely something that needs to be taken into consideration when taking these.
Absolutely. It's not a magic injection or a magic pill, but it can help. So here's the problem with hormone therapy or lack of desire. A lot of times you do have the desire. When I say you, I'm talking about the gray matter contained within your skull, your brain. So when you look at somebody, look at an attractive woman or attractive man, depending on your sexuality, it does register in your brain. But what happens is you don't have the feedback mechanism. And what I mean by that is, as the penis starts to fill with blood, even just a little bit, there are a lot of nerve endings in there. And whether you're aware of it or not, those nerve endings talk to the brain. So what the brain does, it says, okay, we're aroused. Let's check to see if we really are aroused. Checks the penis to see if the nerve endings are being stimulated. And if they aren't, which on hormone therapy is what happens, the brain goes, oh, must be a mistake. All that happens without the patient, without the man knowing it. He just thinks, oh, I don't have any interest in sex anymore. Yeah, yes, he does. Absolutely. We had a conference in which I asked a gentleman, if I gave you a picture of 100 women, could you pick the most attractive 5? Now, he said that he hadn't had sex in 5 years and he would like to have it. And he feels like he has no sex drive. And he said, absolutely. I said, well, then the brain's still working. You know the difference between attractive and not attractive. It's still in the wiring. So let's go back to Trimix. Now you have a feedback mechanism where the penis is hard and it's feeding back to the brain. The brain's going, oh, something's going on. Something's going on. You know, this is something I need to pay attention to. So with Trimix, you're doing it backwards. The penis is going to get hard first, and the brain's going to be a little bit confused and go, well, you know, we've got an erection, but you weren't thinking about it. Well, now we can think about it. Now we can put 2 and 2 together. And yes, it can make a difference. So somebody with low libido or no libido, once they get that erection, all those nerve endings are going to come into play that haven't in a long time, sometimes for men, some men, many years. And it is going to make a difference.
So one of the conversations that Dr. Scholes and Dr. Moyad had with actually John Mulhall, who's an expert in this field, and we're going to link his full talk in the description of this video because it was tremendously helpful. And he does speak a lot on penile injections within the video. One of the things that they talked about is doing these types of injections 6 weeks after treatment when it comes to surgery, so that you're making sure you're getting these regular erections and using that muscle. And so the 6 weeks it was kind of eye-opening for me because I've been, in prostate cancer for quite some time, and I had never heard it was done that early. And so I think that that's a really important point for men to understand, that if you are, embarking upon these treatments, maybe you're thinking of getting them, I would talk to your doctor about when to use penile injections at what point, and talk to your medical team about it, because it's very crucial to be able to use that muscle and not let it atrophy over time.
Yeah, the muscle does atrophy. Just as if in school, one of your classmates broke their arm, the arm goes into a cast, comes out of the cast sometime later. When it comes out of the cast, the arm and the muscles have shrunk. And the penis is a muscle, so it is going to shrink. And for some men, what actually happens, it depends on how long you're on hormone therapy for, but the spongy tissue in the penis, some of those little nooks and crannies can actually become one. So instead of this nice area that has the ability to fill with fluid, it's collapsed on itself. And for some men, that will result in Peyronie's disease, which means your penis is curving. Also, for some men, their first erection after hormone therapy or an erection like this with the injection, there's some pain there, but it's not the kind of pain of having too much Trimix. It's minimal. It is use it or lose it. So that 6 weeks after the surgery, having Trimix helps to fill all those cavities again the way they should be. And the way nature designed men is to have an erection every night, whether you want one or not. The brain's going through its checklist. And part of that checklist is make sure that the penis is filled with blood at least once every 24 hours. And for men on hormone therapy, that may not have happened for years. Or even if it's 6 months, that's something that's never happened ever to that patient before. So it is a new thing. Filling those spongy tissues with fluid and using the Trimix that 6 weeks after surgery. That's really important.
Can you regain some of that shrinking tissue, or regain any of it? Because a lot of times in the comments section, and for me this is heartbreaking, it's men who didn't know about penile injections, did not do their conversations with their doctor, that never came up, or maybe they were never put on Cialis or Viagra. And this happens a lot in international circumstances. I see this a lot in India in the comments that I'm reading in different countries, where men were never told that they need to take care of their penis after treatment or on hormone therapy and the duration of it. And it is heartbreaking because they're going, can I ever get back to where I was or even close to it?
That varies a lot, patient to patient. You're probably going to have some shrinkage that's not going to come back. just
Right.
straight out. It's not coming back to where it was. And now that I've said that, there'll be, 1% or 2% of the guys going, yeah, I got it all back. I said, that's great. But I'm really talking to the 98% of the guys, and I don't want them to be depressed that they're in a minority. No, you're in the majority. And some men will have they'll have a shrinkage of like an inch, and they'll be an inch shorter than they were. So they need to keep that in mind. And one of the ways to possibly stop a lot of that, right? Doing this 6 weeks after surgery will minimize that. It won't get rid of it, but it will minimize that.
It's almost like we need to start a campaign and encourage men to use it whether you feel like it or not. It's not a feeling. You may not have that feedback loop, as you said, but it does need to be a daily concept that you do, that you think about in your brain. Like, how am I going to take care of this? Because, a lot of times men on hormone therapy may not do anything for a while, and then when they're off, the testosterone may come back, they start to have interest in sex again, but they haven't used this part of their body in quite some time. And obviously that's not the case. It varies patient to patient. It's not the case in everybody. But I have seen this happen. And so what advice would you give to men, just is kind of like creating a workout routine? And that's a crude way of saying it, but maybe you have better words than I do.
Well, it really goes back to use it or lose it. And everybody's different, right? And sex drives vary from person to person. So if you have a man that had an orgasm every day for most of his life, you also have men who have orgasms once a week for most of their life. So I would suggest that you try to go to what was natural for you. If once a week was natural for you, try once a week. If once a day, try once a day. It really depends on what it is that you want to get back. Now, I will backtrack just a little bit on that for you, because on the guys that didn't have it as often, you're all in the same boat, and you've just had this surgery or you've gone through hormone therapy. And so you're in a different place than you were. You're probably going to have to, quote, work out a little bit more. You're going to have to try to masturbate. You're going to have to try to get an erection. You're going to have to fantasize. You're going to have to take Viagra and or Cialis to try to do something. And so it's a little bit like going to physical therapy. But again, the penis is a muscle and it needs physical therapy like any other part of your body that might have been injured.
One of my biggest issues is that, and I'm really, I'm an advocate for all men in prostate cancer, and anytime I read the comment section or I talk to Helpline, my heart breaks, because one of the typical conversations that I'm seeing men say is that they go talk to their doctor about their erectile dysfunction issues, and the doctor is dismissive, short with them, and doesn't give them enough time to explain it. And I had one patient, and this is, I know, happened multiple times, it isn't just the one patient, where the doctor told them, listen, you're alive, you're on hormone therapy, why do you care? Like, you're 80 years old, it shouldn't matter anymore. The doctor should not be telling a patient that. That's ridiculous. Can you give the patient some tips on advocating for this? Because you're not only advocating for your quality of life, but it's a main function of your brain, of your body, for as long as you've been alive. And then all of a sudden, someone's going to tell you it's not important.
Right. Well, when a doctor tells you that, the doctor's telling you more about himself than about what you need. So maybe he doesn't have a sex drive anymore and he's 65 and it doesn't mean anything to him anymore. Well, it doesn't mean something to you. Doctors, as Dr. John Mulhall has said many times in his excellent book, How to Save Your Sex Life, most doctors don't receive any training in sexuality. How do you deal with a patient's sexuality? And prostate cancer, I'm sorry, but it's going to involve your sexuality because it's involving the penis. And you do have to advocate for yourself. And if a doctor doesn't want to give you a prescription for Viagra, Cialis, I'd just say, I'd like it. Please give it to me. No harm. It's not going to harm me. It's going to help me. And by the way, these prescriptions, Viagra and Cialis, were originally developed for heart patients. These prescriptions are good for your heart. So as Dr. Mulhall has said, if it's heart healthy, it's penis healthy. If it's penis healthy, it's heart healthy. More than 15 years ago, I started taking 100 milligrams of Viagra and cutting it into 25 milligram chunks. And I've been taking it every morning with my vitamins. And that has helped me so that I don't have as many problems as far as getting erection as I would have had. And I had heart disease in my family. So I was trying to prevent that as well. And actually, recent studies have shown that patients who are on Viagra, that are on drugs like atorvastatin are on drugs that lower blood pressure and cholesterol, have the least risk as far as heart-related events. So these are good drugs. Talking to your partner is a big deal.
Yeah.
And I think that depending on your relationship, it could be as easy as we're talking, or it could be extremely difficult, or you may not be able to do it. We're thinking that the man is having sex with his partner, or that he has a partner. I will get helpline requests for a daughter for her father. And, well, my parents aren't having sex anymore. Or, my parents are divorced, or my father's single. Well, you know what? Guess what? He may still want to be sexually active. He may still be able to and want to fantasize and have an orgasm by himself. And that's his right. You have family members sometimes running interference where, oh, he doesn't have to know about that. He doesn't have to know that. He doesn't need to take Cialis. He doesn't need to take Viagra. He's too old. It doesn't matter. That doesn't count. And it does count. And we need to let the patient determine that.
Well, what is advice that you would give to men on talking to their partners about this, especially if the wife or the partner is not interested?
I think the thing that always bothered me when there's some type of interpersonal communication issue and somebody's talking about it, and they want you to think they have all the answers, and at the end of the conversation, everything's going to work. And that's not the case. So let's start with the failures. So it is possible to have a failure talking to your partner, and that your partner has decided that this is not something for him or her, and that going forward, that they're not going to be part of this. So let's start with that and acknowledge that that can happen. You, as a man, may still want to be able to fantasize and be sexual yourself and have orgasms. And that's something that's your choice. And that's the only thing that you're going to be able to do because your partner's now out of this. Now, if your partner is receptive and open and you've always had a good relationship, then it shouldn't be too difficult. You want to approach this is nobody's fault. This isn't a fault situation. This is something where something has happened to both of you. As we age, things happen to us that are beyond our control. And also, if you're both in a situation where you haven't had sex for a while, going slow and not having it be your traditional way of having sex might be just sitting in bed and talking about it. And actually exploring each other and stopping and starting. Don't have in your head this idea of this great finish, right? You're both going to orgasm at the same time, and it's going to be like you're 19 years old, because of course there's always that possibility, but the probability is that that's not going to happen. So I think I would, when you're talking to a partner, is basically say, we're going to have sex, but we're not going to have sex. We're going to just explore and play. And maybe we're not aiming for orgasm. Maybe we're aiming for being comfortable with each other in a more sensual setting. Maybe you take 15 minutes, maybe it's an hour, maybe it's 2 hours. I know people that have literally just gotten into this and gotten to talk and been in bed for most of the morning without having traditional sex, but just getting to know each other again in that way. Also, this is a great opportunity because many people will have sex just like they go shopping. Doesn't require a lot of thought. Now that they're older, they have many more years together, they have more experiences together, maybe they can start talking about other things that are part of sex, because sex doesn't just start in the bedroom. It starts with how you think about that person. Are you helping them? Do you feel like you're helped? Do you feel like you're valued? Do you feel like you're respected? That's all part of the conversation. This isn't just mechanical.
Well, John, thank you so much. I just want to kind of recap this to the audience. This is information, not advice. Don't take anything that we said here as advice for you. Oh, I'm going to take this dosage, or I'm going to try Trimix, whatever it is. Please talk to your medical team. The disclaimers are up at the beginning of videos for a reason. We want to empower you with information so that you guys can have better outcomes, but your medical team is a crucial part of that. If your doctor hasn't mentioned that to you, one of the big things that we see oftentimes as the comments is patients get upset. Oh, my doctor didn't say this to me. You have a limited time with your doctor and they're trying to keep you alive. They're checking your PSA. They're dealing with a lot. And if they hear from you that it's a priority, make sure that you're carving out that time with them. You can even email the office and say, I would like to make a specific appointment in order to deal with some ED issues that I'm dealing with, or I would like information about this. And they could either get you to your physician or the PA or the RN or whoever you need to speak to about this. And make sure you do your research. You know, if you're going to go to a compound pharmacy and the doctor's sending it to you, you can get multiple opinions in this area. You can get different information on the compound pharmacies and in the different dosing, but make sure you're really customizing it for you. But the best thing that I could ever tell you is please be vocal about what your needs are. I understand that this is an intimate and very intricate situation. There's a lot of nuances to it, but it's extremely important to speak up for yourself, because even in sexual activity, whether it's post-treatment, during treatment, it all matters. You matter holistically as a whole person, especially that part of who you are and how you were before. We want to make sure that it may not be the same as after treatment, but it's something that you feel comfortable with. We want you to feel comfortable in your own body. Thank you so much for listening, and I hope you have a great week.